and taking out time. And yeah, good evening, everyone. Today's topic, as Nirupa discussed about that digital health and more so, we are going to talk about the strategies on adoption of digital health. As we all know, we are, in a pandemic, how digital health has been accelerated a lot, in terms of the teleconsultation, remote monitoring. We are seeing every day new startup is coming up, with a lot of their new features on, how, I mean, everybody is trying really hard to come up with, to cope up with the pandemic, and also, trying to help people even to get to a remote access, because of course now we don't see the physical access is really possible, so the virtual access is what has been seem more relevant. So yes, many startups are trying. I mean, even in our incubator too, there are a couple of startups who did pivot, completely went into virtual. They had community clinic, now they became a virtual clinic. So a lot of startup, a lot of new things people are trying, but then are we ready? I mean, in terms of the adoption, are we still there? So we are going to talk, and of course we are going to get insights from Sumit, who's in this space for more than 2-3 decades, and has been serving two different hospitals across globally, and other payer provider and then patients. So we would understand the a little bit of some of the playbooks and some of the strategies, what it takes in terms of the adoption. And in fact, post 30 minutes, we can always have a Q&A. So any questions you have, please keep putting it on the chat box, or keep it with you, so that you can always discuss later. So with that, I would like to open the floor for for the discussion. So Sumit, yeah, again coming back with my same question, you being in this space for so long. First of all, I would like to start with what are the very obvious challenges you see, and then we will go with the strategies or the solution you think might actually help more practically. So
sure. First of all, thank you for having me here. Obviously, it's nice to share experience, right? And also, there is quite a lot of learning I'd expect from the questions from the group, right? So again, in terms of the challenges which you asked for, there are several challenges when it comes to digital adoption, right? And to name a few, I'd say clinicians' resistance, right, to adopt a change, right, would be the one of the biggest challenge, because again that itself has got several reasons. Obviously, because of doctor patient ratio. If you look at our geography specifically, right, the doctor patient ratio is so less, right? Now if we want the doctors to start using digital channels, right, to start using EMRs, for example, they don't have time, right? If having them adopt to electronic platform is not going to be easy, right? The second challenge, in my opinion, is integration difficulties, right? And again, when I say integration difficulties, I'm talking about interoperability, especially with legacy applications. And we've got so many applications which exist in medtech space, right? Now, not all applications have been thought through in terms of, again, when it comes to design principles, when the systems were built, they were not very well thought through. And without integration, obviously, data becomes restricted, right? You don't have enough data to be able to use the data for a better experience for the patient, right? Third, I would say, is skill availability, specifically when it comes to IT skill availability, right? Although we do have IT skill in India, but I still believe you can't just deploy somebody just with plain IT skill, right? You need to have techno functional skills, specifically when somebody is working on a med tech kind of engagements or projects, right? Because it requires somebody to understand the domain, and especially with because of the users you're interacting with, right? They don't have time to give you the information, right? And last most important piece is cyber security, right? That is something which we all have to be very worried of, right? We're seeing so many hacks which is happening. Again, data security has been a concern, right? And I guess these are the key challenges in my opinion.
I completely, agree with you. I mean, I think the solution need to be so seamless and so, something. I mean, we always talk about design thinking approach while you're actually innovating. So it has to come from a very outcome driven perspective, I believe. Then you start from a technology, side.
Right. So you talked about Playbook, right? And let me speak about it a little bit, right? So there cannot be a playbook for adoption, if you ask me, right? Because we need to be looking at different segments, right? Differently, right? Now, when you look at urban India, it's the playbook will be very different when it comes to rural India, right? Now, but if I were to list down some of the strategies which I would apply when I am trying to increase adoption, I think the topmost on the list would be patient-centric approach, right? We need to have patient-centric approach. We need to apply connected strategy, right?
Yeah.
And when I say connected strategy, I like to expand on that, right? So we need to, when somebody is building a product, we need to look at how can we not build a product which is episode based, right? A lot of things which we build is episode based. Like, let's take an example, right? There are a lot of online consulting tools or products which you've seen recently, right? I myself use quite a I had tele consultation in the last 1 year, twice or thrice, right? But these were very episode based, right? I book an appointment, I speak to a doctor, I have the tele consultation, I get a prescription, that's it, right? Now that to me is only the first level, right? You're creating a frictionless experience for a user, which is great, right? Now, how do you use the data which you already have, right, to build on that? Right now you have the prescription in your system. Now, how do I use the prescription data and create a curated experience for the consumer, which is a patient, right? By nudging them to say, okay, you've got a prescription which says you need to have X, Y, and Z medication, right? Do you want to order the medication, right? You're providing an option to the consumer to also place an order for a medication to be delivered at home. That doesn't stop there, right? Now you also have the regime, right? So how can you, when I say how can the application nudge the patient to say, okay, you need to have the medication, it was twice a day, it is time for you to have the medication, right? And I think it can be taken to a various level, right? Now you have the entire data. How do you use the data for analytics and for predictive analytics and whatnot, right? So I guess there's so much which can be done if we have the patient-centric approach, and also we build that connected relationship, right? Instead of just looking at as episode or a transaction, right? And like you said, we have to apply design thinking principle, right? Now, design thinking, when you're applying design thinking, you'll also need to look at futuristic approach, right? Now, you need to, while you may want to build 100 different functionalities, but do you want to build all 100 at one shot, or do you want to have those stubs and proxies in mind, right? You need to have the system has to be interoperable, right? You need to be able to integrate. You should, because gone are the days where somebody is going to buy one system and live with one system. They will look at best of the breeds, right? Now, how do you create microservices, right? How do you create modular? How do you have a modular approach, right? And I think those are things which needs to be thought through. In my opinion, these are things which will help somebody who's coming up with something new to be successful, and that in turn would help with adoption. I'll pause there, see if it made sense.
No, absolutely. I mean, in fact, I would also want to clarify one more thing. Like you mentioned about the integrated approach. I mean, why today we can shop on Amazon with one click, and I don't have to think of the rest of the things. It's delivered at my home, at the comfort of my home. But in terms of the healthcare, it's not true yet, right? I can't do a one-click touch and then my things are done. So I think that's something would be it's a vicious list, of course. I mean, one would want something similar for the healthcare, but how that is possible in terms of the startups, right? Startups are not really, can they really take care of the integrated, the entire end-to-end solution as one entity? Or what do you think the solution could be?
The way I see it is, end of the day, if you look at Amazon, the example which you took, they're not doing everything themselves, right?
Right.
They are aggregating, right? They are connecting the customer and the supplier, right? Now, if you look at, let's take a product, right? Now, if you're building a product, if you have been building a solution, you may want to look at, okay, I'm building a product, but the product I'm going to only have, my core or USP is only X, right? Now, this is my USP, but for this to be successful, it needs to be able to interact or interface with few other systems, right, or functionalities to give a holistic experience for the consumer, right? So I should not go ahead building those components. I should use, you have B2B, you should look at B2C and B2B, right? So for B2B, you need to have interfaces, right? You should be able to interface with others, right? And if you have only if you have that design thinking or mindset, then only you'll be able to get there, right? Otherwise it will be built in silo.
Yeah.
I hope I answered your question.
Yeah. So, I mean, so you're saying basically you don't have to really reinvent everything. It's all off the shelf. You can just plug in, and integrate on your own platform in case if you have a platform, but, excel at one thing and then again try and find and fit more other solutions which would make the entire ecosystem complete, or the solution.
Exactly. So you need to create a stickiness, right? Once you've created a stickiness, you can always add additional functionalities to it, right? But a lot of times what I've seen organizations do is they try and do everything, right? And if you're trying to do everything, obviously you need a lot of investment, and you start getting frustration, right? Because it's not moving, you're not being able to take it to the market, right? So why don't you step back and start small, right? And do it right and build on that.
I agree with you, because even in tele consultation also, if you see, I mean, what do you think? What's your suggestion on, because you have an entire spectrum of disease, right? I mean, a specialty, should we go for only oncology, nephrology, in cardiology? There are so many, different units, are again, the areas are there. So in terms of, let's talk about if it is a telemedication startup, and do you think they need to go much more specialized and really build those their expertise on that? Because again, it's building relationships. So today, if I would have a issue on oncology, I know that, okay, this particular company is just doing oncology, so they might be I feel like, okay, I think they are very niche and they would be knowing much better than being a general practice. It's like GP and a specialist.
Right. So again, I have my opinion there, right? So if I have somebody in my family who's got who needs an oncology support, right?
Yeah.
Would I use a telemedicine platform to start with, or would I use that for ongoing treatment or care, right? I think those are things we need to be very, when it comes to specialty, I would not build a product or start with focusing on a specialty. That could be something which I do for an ongoing care, right? From care management perspective, but not for consulting, right? Because you'd actually want to make it, you have a generic look at all vis-a-vis focusing on one, unless there is a very clear need, again, depending on the market segment, right? If the market segment requires that, and that could also be the interest of the founder, right? Now the founder is passionate about oncology, right? He's got a background in oncology and he wants to build something, and he's got some nicheness, right? In terms of, he brings a value. Yes, definitely. Then that would make it that successful. But that also would need a supplement, right? You would need to supplement with something which would help jumpstart, right? Because developing a platform just for oncology, right? Scratch and expecting somebody to use it may not, may not be something which you'd go for day one, right? It may not be successful day one. You need a push, right?
Okay. There are a couple of companies who are trying to be very, very specialist, in terms of the specialities, like OncoStem is there. There is another company, onco.org. So it's a like complete solution. I mean, second opinion, from surgery to everything. They'll take care of everything, even, the caregiving, connecting you with the other patient, what their experiences are. So you basically feel a complete, a place where you would like to be associated when you're going through something like this.
Right. So there are companies across the world who are doing that, because that they basically using the care pathways. They've created care pathways. They've got care plans. Right. They've got the entire regime which they've been able to build based on historic data. Right. So obviously, for that to be successful, there has to be a strong value prop. Right. And that value prop has to be built based on data which they already have, because building that from scratch may be difficult. That's what I was trying to get, right? It cannot be, it's not an easy segment, but for that to be successful, there has to be enough data, enough evidence, right? And once it is successful, that can be used again from B2B perspective, right? I have a platform which is generic, and I may want to use oncology, and that's where I actually use that platform as a sub, workflow, if I may.
Yeah, I get it. I mean, it's actually very, very hard space. I mean, also it depends on what founders, as you rightly mentioned, that what is the strength and from where the founder is actually coming from, right? So if a founder itself is someone who's a cancer survivor, right, it makes complete story. I mean, there's a lot of reason why the person is actually doing it. So I think you obviously have a story behind it, whatever you're doing. So it's always makes sense why you are doing it, right?
Exactly.
So yeah, so with that, I'll go to the next point, which you also mentioned about the the integration part. I mean, how can you elaborate in that, what all integration you actually mean about it?
When it comes to integration, I was talking about having the system being interoperable, right? When we're designing a system, we need to ensure that end of the day, a system can be, when it comes to digital health, the success would depend on the data. The power is based on data for predictive analytics, predictive health, right? Now, for the system to get the data, you need to be able to interface with different channels, right? Now, not only interface to get the data, but if you look at let's look at India itself, right? With the digital health initiative, right? There is going to be a lot of focus in getting data. There is going to be a lot of focus on health data exchange, right? Now, if we don't think ahead, if we're not looking at using Fire or HL7 right now, if somebody is building a system and they're not looking and not having that design principles in mind, there is going to be a lot of rework they will have to go through, right? So how do you ensure that you are interoperable, and how do you also ensure that whatever data you have, you're able to derive meaningful outcome from that, right? I think those are important parameters in my opinion. And a lot of organizations, or a lot of, I'd say, organizations have done that, and a lot of countries have successfully done that. In fact, I still remember 15 years back, I used to support in UK Health, and there's something called Spine, where you could any GP could exchange health information with another GP based on patient consent, right? So I'm talking of 15 years back, right? If somebody in UK goes to a clinic and the GP doesn't have his data, he could actually, based on patient consent, request for the medical record from another system which would come centrally to him, right? Which is beautiful, right? And those are things which we need to be getting at, right?
I mean, I think for that, the first layer is having the system in place, right? I mean, we don't have any medical record as of now. I mean, forget about here to there. Even I want to see my own medical record. I won't be able to see because I don't know where it is stored. So exactly. That itself is a first layer itself is not built.
Correct. First layer itself is not there. So if for first layer to be there, we need to have that data in a structured, database, right? Instead of it being stored in an unstructured data, right? Because if it is, at the get-go itself, that design principle needs to be there.
Yeah. I think we had a long discussion on this, that how and why we can't have a unique health ID like the Aadhaar and other things. So once I think there's enough detail on digital health, a mission, and things are moving towards that. So maybe, do you foresee like this can happen in some 5 years time or something like that? You talked about 15 years back. Can you take us to future and say that in these many years I see happening?
Okay, that'll be very very hard to say. I'd say it hard to say because it is not going to be easy. It is going to be very difficult. I think we need to get our fundamentals right from getting this unique health identifier, which we were briefly talking about earlier this week, right? Again, it needs to be clearly thought through, right? Again, when it comes to adoption, it's not going to be easy because of multiple reasons, right? Again, reasons including we'll be dealing with different segments of population in India, right? There are pockets where rural India doesn't have enough internet connectivity itself, right?
I think he just lost his connection.
Yeah, I think so.
Okay, let's just wait for some seconds. He might come back with another network. Yeah.
I apologize. I got disconnected. Am I back?
Yes. Yeah, we can hear you.
Sorry. Sorry, I got disconnected. Yeah, so I don't know where I was, but can you hear me, Sonali?
Yes. Hi, Sumit. Yeah, you're back.
I'm sorry. I am.
Yeah.
I was hoping today I'll not face this issue, and I did.
It's Murphy's.
Yeah. So I was talking about digital health adoption in India. It is not going to be easy because of obviously the internet connectivity, and we face that right now, right? And also
as we speak, that's going on.
If you look at the doctor-patient ratio, right? It's not that great in India, right? Plus the literacy and all that. Several reasons, correct?
Yeah.
And obviously, we need to be starting.
Yeah. What are the? Can you hear me?
I can.
So since you have spent so much of time on on building and deploying solutions, yeah, I'm saying, since you have so much of experience of building and deploying solution on US and UK, I mean, what are the learnings you think we can take from there? I'm sure we can't really take everything because anyways the systems are very different, and you were talking about the rural health doesn't have even the network itself. They don't have internet, so we can't really take everything, but some of the things from where we can take and learn and adopt in our system. So if you can share some of your insights from your experience working with the other countries.
Yeah, I'd say that's going to be, articulating that in few minutes going to be very difficult, to be honest, right? The way I would articulate it is we need to get the best out of healthcare practices followed by different regions, right? There are certain things which are great when it comes to UK, we should pick that up. There are things which have been working really well when it comes to US, we should pick that up. We would not want to copy what exists in a specific geography. Let's take US as an example, right? The cost of healthcare in the US is is very high, right? And that is something which we not want to have, right? Because just because we copy what exists today in US, right? And UK, the market is very different. Healthcare is paid by the government, right? So again, we'll have to take, like I said, best of what we've seen in different countries, right? And again, not a straight answer, but obviously there is lots to learn from UK, lots to learn from US, and lots to learn from South Asia as well, including Singapore.
Yeah, that's what I mean. If you can give some example from there, if you have anything to quote about, like you really felt that can actually work in India as well, in terms of the payer, provider, or insurance. I mean, anything you think can actually work in Indian settings.
Yeah, so if I can give few examples, the health information exchange which I talked about was world class when it comes is world class when it comes to UK. That's something we should learn from UK in terms of how when it comes to interoperability, right? When it comes to care pathways, the EMR, EHR adoption, etc. Those are something which we could learn from the US. When it comes to value driven care, right? And that's something is a journey which UK has excelled. We could learn from there, learn from UK. Again, several examples, right? What when it comes to telemedicine, teleconsulting, I think that's being used across different geographies, and that's been fairly standard, right? Again, there's so much to. You there, Sonali?
Yeah, I'm here. I think there is network issues, so you're coming on and off. I'm not sure how the others are taking it up. Yeah. So anything on the from the data privacy side, you think, like it's already very well defined there, and then we need to learn something from there, because in India I'm not sure, because we are very new about the concept of telemedications and all that. Earlier it wasn't there, so we don't know who owns the data, what's happening and all. Is that all very sorted over in different other countries, and that's why there's more adoption, because people also understand where the data is going, what's happening, and I'm more there's more trust, there's more this on transparency on how I'm how the data is handled.
Yeah, when it comes to data privacy, I would say everyone is learning, and that's a continuous process. Because obviously the hackers learn every day, right? And again, that as an industry is continuing to evolve and continuing to learn. Definitely, when it comes to India ecosystem, we will need to learn from all the countries, and the experts when it comes to data privacy and security, right? And learning. That's something which I don't think anybody is mastered as yet, right? Because we see data breach happening every day, right? Every day, nobody is prepared, right? Every day we keep hearing about data breach.
It's getting on and off, so I'm not sure how others Sai, how is it coming, and you have questions over there?
Yes, Sonali, it's actually breaking a little.
Hmm.
So one of the question we have is like, 1 second. They were just commenting when you were speaking on verticals. One was commenting on the dentistry specifically, like having a teleconsultation for dentistry. And one more thing, I'll just read it out. How do you drive new technology adoption? Let's say like we develop a ventilator machine. How do we convince doctors, clinics, hospitals to shun hesitancy and adopt them?
Okay.
Basically,
Yeah, if there's a new med device, I would look at piloting it, picking up one clinic, one hospital, getting the credential build, and then expanding on that, right? So instead of trying to build the entire ecosystem and trying to go big bang, create a pilot, do an MVP, test it in one or two sites, get some credential, and these sites have to be renowned sites, okay, where you basically you're using that as a learning ground, as well as that credential is something we could use to market. And once you've got the credential, there is no looking back.
thanks, Sumit. So we have one more question. So, being a startup, like how should they uh, pitch to hospitals and like organizations to, I mean, make their product a part of their existing care?
I would actually add on to this that question, like whom should they pitch actually? Who's the right person to be pitched in a hospital? Because there's so many, stakeholders involved.
That's a good question. Actually, it would depend on the application itself or the product itself, right? Now,
Hmm.
if it is a specialty based product, I would go to the head of the specialty,
The
right?
doctor.
If it is, yeah, the doctor who because he would have a larger say, right?
Hmm.
uh, Now, obviously, when it comes to if a product, it would need to go through the CIO organization if it is a software, etc. Right? So the CIO could be another organization which they could pitch to, but getting the buy-in from the user, and user in this case will be the specialty, or it could be, if again it could be a lab as well, right? It depends on the product, who is the user. If the user is convinced, I'm sure they would be able to influence decision.
So we have one more question, Sumit. Small and medium hospitals still doesn't see value in EHR. How do we convince them when government doesn't mandate it?
It is not going to be easy. It is not going to be easy for EHR EMR adoption. uh, Several countries have struggled, several countries have failed. Now it can only be adopted if there is an incentive, right? And I believe that is something uh, which we may see in India. So again, I'm not part of the advisory to say what is our government trying to do in terms of adoption and what is going to be their strategy. But if it is driven by incentive, that would push the hospitals to embrace EHR EMR, right? Because it is not going to be easy, because like I said, doctors do not have time, right? They've got we see it every day, right? There's always a queue. They do not have enough time. If you expect them to start documenting, that's not going to happen unless they start seeing incentives. And also realization of why is data going to be powerful, because we're just storing the data, we're not using the data for meaningful purpose, right? Now, unless we also there are systems and solutions which is being used in a hospital, which is being demonstrated as okay, because of the data and analytics, they've been able to do predictive health, and there have been some success, right? Which they could showcase, others would start following it, right? I guess it's a combination of push from the government, but push with incentive, and also pull based on outcome, which everyone starts seeing. And also for smaller clinics and hospitals, I believe the success would also be dependent on if they are able to exchange data for for outcome, right? Now, if somebody looks at creating a data hub, which has got data for several hospitals, and that's used for predictive analytics, predictive health, right? Now, and that's very, that focus on specific region. India is a region. We would the data is going to be so powerful, right? Based, what works for a specific disease, right? For a specific locality, for a specific, I think that's something which is not there, right? And I think those are things which would pull hospitals to start adopting, but they need to see a value, right? It's all about seeing a value.
Yeah. Incentive and government push. These two.
Incentive, government push as well as outcome, right? What's in it for me, right? Everyone looks at what's in it for me. If you ask me to do something, I'll also always think what's in it for me, and that's true with everybody if you want them to change.
True. Any other questions, Sai?
That's it, Sonali. And one more question we had was, what's the strategy to start a startup, as he's interested in starting but don't know where to pitch specifically? A generic question.
That I will leave it to Sonali to answer.
I mean, any particular idea is mentioned, or it's like want to start a startup?
No, it's a generic question, sir.
How to start a startup? Is that the question?
Yeah. What's the best strategy to start a startup, as I'm interested in starting up but don't know where to pitch my idea?
Okay, so I think I would say first, please, and go find out what problem you are trying to solve. I think you really need to find where do you want to be, what problem you see, and what you want to address. So do not start with what right now look like your state of mind is really not in the problem side. So definitely go and find. There are so many problems are already there. Do not start with if you have some technology or you're thinking what to solve, what problem to solve. So come with the outcome driven, as we are talking about, as we are speaking, that only, I mean, anyways, we see so many challenges on the adoption. So if you just create a solution where no one is ready to buy, again, it's another just piling up the solutions which are not even needed in the market. So start from the market research, do a lot of market understanding, talk to the stakeholders. If I mean, I hope you have some idea that what you want to build, right? It could be a device or it could be a software, and this comes with what is your strength. So are you a biomedical engineer guy? Then yes, you would have some understanding on the device side. Are you a software guy? You would have, or a coding guy or something like that, right? So some understanding would be there, and then you go and find out that with your strength, what problem look like that you can solve. Because again, the problems are a lot, solutions are also a lot. I mean, there are a lot of problems but you also need to find out what you can solve with your strength, right? Otherwise, I mean, it looks like, again, there would not be a good fit. So I can't go and solve a problem on finance. I'm not a finance guy. So similarly, if you are a person of, I don't know what's your background, check your background, check your strengths, and then see on those lines what problems are existing already. Try and see how you can solve by coming up with a solution. And the solution should also be something which could be commercialized and scalable.
True.
That's something
technology is just an enabler, right? A lot of times there's so much of focus on technology versus the outcome or the result, right? And that's something, it's that's one reason why a lot of startups fail, right? Because there's a lot of focus on the UI UX very important, right? It has to be user friendly, but there has to be more the focus has to be what's the outcome, right? What's the experience? How have you established the relationship with the customer or consumer, right? That connected relationship, I believe it's a key, right? How do you build a connected relationship with consumer as well as supplier, right? That would help any organization be successful if they do it right.
I think I mean there should be a lot of market research on the healthcare requirement too. There's already so much market research on the retail side or the fintech side, but I don't know, there are a lot, but I don't know what people are doing with the data. What as a customer, what are we looking for? Are we looking for a preventive healthcare? Am I a person who wants to be fit? So why can't we have those sort of discussions, and something like that? One can understand those data and try and build a solution for that particular group of segment.
True.
Yeah. I would actually like to go back to the first question which Sai asked, that I think we missed the question which was asked, that how to pitch, and that's very important, how to pitch to a hospital, because it seems like you did crack the secret, and working with the hospital. So how did you pitch? What was your first pitch look like?
Yeah, so I have not pitched to a hospital. I have worked for hospital, right? I have worked for several hospitals, supported their IT, right?
So you pitched in terms of the customer, like they.
Yeah, so I was actually, they were my customers in few places. In few places, I was part of the hospital itself, right? Now, when it comes to pitching to a hospital, and in fact, I got pitched as well. A lot of times there were suppliers who used to pitch. Now, what I would look at is what problem, like you said, what is this problem? What problem will this solution solve, right? Are there better solutions in the market, or do I have an existing software or a product which I could use, right? Instead of bringing another one. A lot of hospitals have failed because they've acquired, or they kept adding suits to their application suits or product suits to their inventory without realizing that something exists which could solve the problem, right? So I guess there has to be a unique value proposition, okay, right? That's going to be the key. And again, there has to be buy-in, and that unique value prop has to be result oriented, right? And only if somebody pitched me a software, I would look at what problem does it solve for me. Do I have something else available in the market or within the ecosystem which is better, or which could solve close to the solution, which provide a solution close to what this product is offering. And what's the cost benefit analysis? I'll also do an ROI, right? Additionally, I'll also look at what's the plan, right? What's the product roadmap, right? Are they scalable vertically as well as horizontally, right? So product has to be scalable. If I'm buying something, I need to know that this is going to be scalable, and what's their strategy in terms of adding additional features, right? Because this market is so rapidly changing, especially the healthcare. If somebody tells me this is the best, and they believe this is not changing, that will be a no for me, right? Because it is evolving every day. The features needs to be there. Again, there is where the modular concept comes in play, right? How are you able to enhance the product on the fly without having to bring in downtime and whatnot?
Yeah, and since you mentioned about the connected care, I just want to sort of add and also seek your insight on that. I mean, you also think I don't know really how the software really works inside the hospital. So is even the pharmacies are connected, or the inventories are connected, or so everything is connected with one platform?
Everything is interconnected, right? So when it comes to a hospital which is paperless, not a single application, there could be few applications which are running in silos, but every applications are connected with each other, including the supply chain management, right? Including inventory management, including HR application, right? HR application is connected to the EMR or EHR. So that would be surprising, right? Why should HR application be connected to EHR, EMR? It is because of admission, and so the information with respect, the doctor information needs to be available, right? Whether he is available today for him to be scheduled, because you don't need to provide information of attendance, right? How do you get attendance information into the system, right? And the payment information and backend needs to be going in, right? And inventory and a supply chain, right? Now obviously if the records if the inventory is going low, there should be an auto PR, purchase request going out and all that, right? Pharmacy, obviously, if I've ordered for a medication, pharmacy needs to be dispensed. Yeah, there's so much. So this, yeah, like I said, health monitoring, and obviously those are given, right, when it comes to hospital. But I'd say 90% of the 90% of hospitals are striving to get to paperless, right? And a lot of hospitals have achieved that as well.
This you're talking about in not non-Indian settings, right?
That's correct.
Yeah, yeah, right. So I mean that's what you said is, of course, India would take some time to be there, but even since our startups are there, they're trying hard, and they're also understanding the space, and trying different ways for the adoption. I How do you see the in terms of the again integration part, like insurance coming in, because that's another a complete separate category. I mean, one have to wait for almost a day for the insurance approval comes in, and then so why it can't happen as we as the surgery is going on or other things are going on, why it's a separate event in the hospitals?
I'd say it's good and bad. If you ask me, insurance not being very neat or
Linked.
highly integrated, it's good one way, because if both sides of the equation are heavily integrated, it may increase the patient, it may increase the cost of care, right? Again, I go back to the US. If you look at the healthcare cost increasing, is because of insurance as well, right? Now, but again, if we take a patient centric view, and that's changing, right? Because now there's a lot of focus on value based care, right? Everyone's looking at outcome, right? Now, in terms of your question, in terms of how does the claim get passed as during the surgery itself, instead of it being, or authorization happens sooner, I guess there is going to be a lot of integration, like to your point, which needs to happen between insurance as well as the health systems, and that's something which needs to be part of the design principles, right? So we need to, as we build the system, look at how do you integrate this. Today, again, maybe the unique health identifier may help solve the problem, if I may, right? And hopefully that is there in everyone's mind, right? Because you don't need to have different identifiers. Now, if I have a unique identifier, I know what's my eligibility. I don't need to base, and my eligibility is information is coming from the health insurance, and that by itself should be used in a hospital for them to do a eligibility check, right? And again, that would mean there has to be provider payer or insurance and health system integration, right? Some interfaces which exist in the rest, in other parts of the world, right? You could do an eligibility verification at the time of registration itself, right? And so it doesn't becomes a patient problem, it becomes the hospital's problem to verify.
Right.
And as a consumer who's already going through the problem, right, I don't have to go through multiple hoops, and which is what unfortunately happens today, right?
Yeah.
You have to go through several deaths to get all this,
Yeah,
right?
you will have to run around. I mean, as a patient, you need definitely caregivers, and people who do not have it, it's really challenging for them.
Exactly. And now this is a classic example, right, of how an integration would help improve customer experience, right?
Yeah.
I don't have to run around, right? I have one identifier, I just give to a hospital, they are able to verify real time what's my eligibility. And at the start of the encounter, and as I go through the episode, they could continue to do the eligibility verification, right? And by the time the patient is getting discharged, you, along with the discharge summary, they also know what the hospital is going to be, they need to pay out of their pocket, and what's going to be paid out of the insurance.
Yeah. Right. I mean, a lot of wishful thoughts, I believe. I mean, this is definitely something we would like to see in future sooner than later, So I think we are about to, finish the time. So maybe if you can just summarize in 2-3 minutes about the strategies or anything you would like to about the topic, just a summary.
Sure. I think we've got a unique opportunity, right? Again, I say this with a lot of passion because I've been there with in this space for 20 plus years, right? And somehow I always say you don't need to be a doctor to provide patient care, and that's something which my team always says, right? Because we are in some way or form impacting patient care, right? Anybody who's part of medtech or life sciences are touching somebody's life, right? So I think there's a unique opportunity for us, right? Whoever is part of this space. And but only again, in my mind, a focus has to be patient, right? Or a member and the outcome, right?
Hmm.
These are three, again, patient and outcome are my two favorite words, right? In terms of, yes, we need to have that outcome driven mindset, and our strategy has to be connected strategy. And I keep using that this with everybody, my teams as well, right? How do you build that connected relationship, right? In your discussions, when you any discussions should be connected. Discussions cannot be transaction, right? How do you leave something behind? How do you follow up, right? You can't just see an episode or a transaction as an episodic. There has to be a follow through,
Hmm.
right? Again, going back to an example, right? I did an online consulting. I would, and if that episode gets over, now if somebody calls me and checks, hey Sumit, how are you? Are you good? Where you, did you need any help? Have you recovered? That by itself would be so pleasing. That by itself will remind me of going back to the
Yeah.
same system or product or whatever, right? Because of the experience I had. I think those are things which needs to be thought through, and I'm sure India ecosystem, there is going to be a lot of opportunity for this sector, and I'm excited. Because I believe we will have lots to contribute, right? Because of the nicheness of this domain, and also because we are starting from scratch, if I may, right? So we've got an open slate to do design thinking and come up with something which we could be proud of, right? And I'm sure everyone would contribute in some way or form if we do it right. I know it was a long statement, but I
No.
hope it resonated well with you.
Yeah, absolutely. I like the thing which you said, that open slate. So I'm sometimes it's actually decluttering is more important. So cleaning, clearing what noisy, and have a clear slate to actually begin a fresh start. So I would actually take that. And we Sai, is there any questions, or we would like to close the session?
No questions, Sonali. I think we are done with questions.
Okay, sure. So thank you. Thanks a lot, Sumit. I will get back to you with more, in terms of the mentoring and, coming up with our startups, taking your insights and see how we can, also work together in some of these things. Your experience and your insights on this, this sector would definitely help our startups. So anything, on the global side or in India, we would definitely come back with that.
My pleasure. It was nice. Thank you for having me here, and apologies for the internet connectivity issues, right? It was not to prove a point we have a problem, right? But
So
yeah, it
I
was
believe it's also Murphy's law. Sometimes what have to happen will happen, whatever you do.
exactly.
So no issues. If the end is well, everything is well. So I think we are
Exactly.
ending on a good note.
Sure.
So yeah, thank you. Thanks a lot.
You.
Bye bye, everyone. Bye.
Bye.
Thank you, everyone. Thank you so much. It was a lovely session. Thank you.